which was accompanied by a tremendous amount of press coverage, and a simultaneous launch by us of a organization to build grassroots small business support for reform. Let me just tell you what's happened. Major chambers of commerce signed on to the governor's plan. Now, the governor's plan is not the perfect reform solution, but it is so much more a progressive solution than where these people were before. That is a huge step in the right direction. The San Francisco chamber, the LA chamber, the San Diego chamber, which is traditionally very conservative, the Silicon Valley San Jose chamber. That's pretty amazing. Another group that is affiliated with the National Small Business Association signed on to the governor's plan. Now, the NSBA itself has not endorsed anything like that, but this is a group that's very tied in with the NSBA. And really amazingly, the California Restaurant Association, the California Retail Association, and the California Small Business Association, all traditionally incredibly conservative, endorsed a 1% sales tax to fund healthcare reform. Now, again, we may not all think that that's the perfect solution, but it represents a huge step in the right direction. So you asked me to offer hope. There is hope that with the right environment, with the right communication, with the right framing, even the small business organizations will move on this topic. I think I'm just going to skip a few things here. So what's the bottom line? The bottom line is we have to change the frame of the debate. We have to appeal directly to small business owners by pointing out why healthcare reform is good for the free market system, good for healthy competition, instead of allowing the opponents to capture the free market banner in the debate. We've got to change and that essentially means changing some of the reform rhetoric that we use when we're talking to small business people. If we don't do this, we're going to end up swimming upstream. We're going to be left only with the moral arguments, and as powerful as they are, I don't think they're going to win the day. If we have economic arguments behind us, it's going to be much more powerful. And finally, I think we need to take a page out of the recent success of the environmental movement. I mean, I think one of the reasons, I mean, there are a lot of reasons the environmental movement sort of crossed over to being more bipartisan and more accepted, but one of the reasons is it's now being framed as a pro-economic development position to be environmentalist. It spawns new industries. It's good for the long-term health of the economy. So I think we have to remember that if we can get on top of a pro-economic development argument, it's going to be a lot easier to get healthcare reform. So.
Thank you. Okay, I'm going to just kind of briefly talk about what's going on here in Colorado and in a way kind of bring down everything that's been discussed. You all hopefully received a handout that has a little matrix of, and what this is the 5 proposals that the 208 Commission is currently considering. And on the other side of that, there's the 2007 federal poverty level guidelines, because so often we say 250% of the federal poverty level, what does that mean? And also, because we so often have all these healthcare terms that we all are sometimes confused, there's a glossary. This is a short glossary. Colorado Health Institute is going to have a longer glossary out in a while, but this one, just to help kind of guide you in if you have questions, and hopefully to kind of begin to get us all on the same page with regard to similar definitions and just kind of an agreement on what we're talking about. I want to reiterate that what was kind of said here already, and that is that much of this is a philosophical, ideological debate that's kind of going on. And whatever we come up with in many ways reflects kind of our values, I think. And I think we're very uncomfortable talking about that, but it's also something that we kind of need to work through. If you look at the proposals that the 208 Commission